Parkinson's disease rarely announces itself with a sudden event. Instead, it creeps in quietly. It may begin with a subtle tremor in one hand, stiffness in the legs, or difficulty fastening a button. At first, these changes are so small that they are easy to dismiss. But over time, the signs become harder to ignore. Walking slows down, steps turns into shuffles, and the daily tasks that once felt automatic now require effort and concentration. This gradual but relentless progression is the hallmark of Parkinson's disease, a condition that doesn't just affect movement. Although it involves a gradual, progressive decline in the brain's ability to control movement, it can also change a person's speech, mood, sleep, and even memory. Millions of people worldwide live with Parkinson's, and while there is still no cure, treatment and therapy can help preserve independence and quality of life. By understanding how this disease works and what it looks like, we can better support those who face it every day. The exact cause of the disease is not completely clear. We know it is linked to the degeneration and loss of specific types of neurons located in the back of the brain, in an area called the substantia nigra or black matter, a small but crucial area of the brain. These neurons act as dopamine factories, secreting dopamine in a deep part of the brain called the basal ganglia, a group of brain circuits that fine-tune and coordinate movement. Dopamine is an essential chemical that acts like a throttle. When a car has a throttle problems, it becomes unresponsive, slow, and starts to jerk. Similarly, in individuals suffering from Parkinson's disease, the lack of dopamine causes movements to become out of sync, slow, and jerky. It is necessary for 80 to 90% of these neurons to die before the first symptoms become noticeable. The exact cause of the degeneration and death of these neurons is not known, but it is believed that a combination of genetic predisposition and aging plays a significant role. Parkinson's disease usually begins around the age of 60, although it can occur earlier and it is more common in men than in women. Parkinson's disease begins gradually, often starting with an almost imperceptible tremor in one hand. It is a progressive disease, meaning it worsens over time. As time passes, the signs and symptoms of the disease become more pronounced. Movements slow down, making it difficult to perform daily activities. Stiffness in various muscle groups can occur, sometimes causing pain. Posture may become affected, leading to stooping, which increases the risk of falls. Getting up from a chair can become difficult, and steps may become shorter. In the later stages of the disease, individuals usually do not fully lift their feet off the ground while walking, a condition known as a magnetic gait. It can be challenging to start walking or change direction, often leading to many small uncertain steps. In more severe cases, there may be an uncontrolled acceleration of small steps that can result in a fall. Occasionally, a phenomena called freezing occurs, where a previously mobile person suddenly becomes unable to move and remains frozen for a while. Over time, there can be a loss of spontaneous movements, such as blinking, laughing, and natural arm movements associated with walking. The patient's face may become expressionless, resembling a mask. Speech can become slurred, monotonous, and lacking normal intonation, often with hesitation when starting to speak. Writing may also become difficult, and the written text can appear small. Chewing and swallowing disorders may develop, making affected individuals prone to choking and malnutrition. In the later stages of the disease, memory impairment may occur, potentially progressing to dementia. Mood disorders such as depression are common, along with emotional control issues like fear, nervousness, and loss of motivation. Sleep disturbances may also arise, including frequent awakenings during the night and drowsiness during the day. Urinary disturbances, such as inability to control urination or difficulties with intermittent urination, are common, as is constipation due to the slowed bowel activity. Not all symptoms and signs of this disease occur in every patient. Additionally, the order of onset, intensity of symptoms, and speed of disease progression can vary significantly among individuals. In many cases, the disease progresses slowly, and patients can continue to perform daily activities for a long time. There is no specific diagnostic test for Parkinson's disease. Instead, the diagnosis relies on a comprehensive neurological examination, along with the identification of specific symptoms and signs of the disease. Additional diagnostic tests such as laboratory tests, CAT scans, and magnetic resonance imaging of the head may be conducted to rule out other potential causes of the symptoms. Currently, there is no cure for Parkinson's disease, nor is there any medication that can slow its progression. However, several medications can either replace dopamine or enhance dopamine levels in the brain, helping to alleviate symptoms and improve the functionality of affected individuals. Typically, most symptoms improve after starting treatment, but they may gradually return over time. Despite this, many individuals can still achieve good control of their condition. In some cases, antidepressants or anxiolytics may be necessary to address mood disorders. Certain individuals with Parkinson's disease may also benefit from surgical treatment, known as deep brain stimulation. This procedure involves the implantation of electrodes in specific areas of the brain and a signal generator placed under the collarbone. The device sends signals to the brain that can help reduce symptoms such as tremors, stiffness, and movement disorder. Deep brain stimulation is typically reserved for those who do not respond well to medication and carries risks, including the possibility of infection and stroke. While this procedure may assist individuals with Parkinson's disease, it does not halt the disease progression. Additionally, people with Parkinson's disease can benefit from medical rehabilitation, which includes physical and occupational therapy, as well as speech therapy. These interventions aim to enhance the individual's quality of life and improve their ability to perform daily activities. Parkinson's disease is more than just a tremor. It is a long journey that affects movement, independence, emotions, and even relationships. While science has not yet found a cure, today's treatments, from medication and rehabilitation to advanced procedures like deep brain stimulation, can greatly improve quality of life. Just as important is the support of family, friends, and community, which helps patients face the challenges of each day with dignity and strength. By spreading awareness and understanding, we not only bring hope to those living with Parkinson's disease, but also move one step closer to a future where this condition can be slowed, stopped, or even prevented. Thanks for watching. If you found this video helpful, consider subscribing for more educational content. Have a great day.